Let me on the brush. Okay, this artery is this is the brachiocephalic artery. Okay, this is the brachiocephalic artery. On the right side, brachiocephalic artery gives origin to the common carotid artery. Okay, this is just behind the sternocleidomastoid muscle. The sternocleidomastoid muscle is over here, above it, and below sternocleidomastoid muscle, you can see the common carotid artery, which is coming on right side from the brachiocephalic artery. And on the left side, the common carotid artery is just coming from the arch of the aorta. Okay, not from the brachiocephalic, but from the arch of the aorta, common carotid artery is appearing. Okay, it goes upward. I have already told you that it goes upward under the cover of the sternocleidomastoid muscle. Okay, and when it reaches this portion, probably this portion would be where the thyroid cartilage is present, and below the thyroid cartilage it divides into the internal and the external carotid arteries, internal carotid artery and external carotid artery. So now I would tell you, we will write over here, the carotid. We'll see, you can see carotid sinus over here. Carotid sinus is, you can see here that just uh, before bifurcation there is some dilation in the artery present. This dilation is called the carotid sinus. Why the carotid sinus is present? The carotid sinus is basically, uh, it has proprioception effects. Reflex proprioceptive mechanism is present when the blood showing. But before the bifurcation of common carotid artery, this common carotid artery is bifurcating into internal and external carotid artery. So before bifurcation, some dilation is present, and this dilation is basically because the nerves are present, cluster of nerves, the glossopharyngeal nerves are present. The glossopharyngeal nerves are basically here. Why? Because nerve endings are present. Why is this dilation is called the carotid sinus? In carotid sinus you can see the nerve endings of the glossopharyngeal nerve. Why glossopharyngeal nerve endings are present? Because these are sensitive to the blood pressure. When there is rise in the blood pressure, then what happens? The blood vein passes through it, and there is rise in the blood pressure. These nerve endings will sense. I tell you again, when the blood passes through it, the blood pressure rises. For example, if blood pressure is high and the blood passes through it, the nerve endings sense this elevation in the blood pressure, and they will do what? They will send a message to the brain, and the proprioception mechanism, the alternative mechanism will start, and this pressure will do what? This pressure will lower the heart rate. This will lower the heart rate, and plus it will increase the vasodilation. it will dilate the vessels and will increase the heart rate, so the blood pressure will become body. Let me write over here carotid body. The carotid body, carotid body. Basically, it is a small of the common carotid artery into the internal and the external carotid artery. Some dilation is present. This dilation is called the carotid sinus. We have already discussed. Below this carotid sinus, we find here it is shown the carotid body. This point of bifurcation below, posterior to this point of bifurcation, a special small structure is present, which is basically collection of glossopharyngeal nerves. And why it is present? Basically, it is chemoreceptive. It has the carotid body is basically a chemoreceptor. Oh, why it is present and what it will sense? It will sense the elevation. It will sense any elevation in the carbon dioxide level and any decrease in the oxygen level. When the blood passes through it, and chemoreceptor will detect the any elevation in the carbon dioxide rate and the lower level of the oxygen level. What it will do? It will alternately increases the heart rate. Okay, so it will increases the heart rate, plus it will increases the respiratory rate. Okay, and it will also increase the blood pressure. So three mechanisms are going to happen. Three mechanisms are going to happen in response to elevation in carbon dioxide and depression in the oxygen level. The heart rate will increase, the respiratory rate will increase, and the blood pressure will increase. And this is done by the carotid body, which is present just posterior to the point of bifurcation, and it is basically a chemoreceptor. And